Guys, I'm here in Alfredo with my good friend, Dr. Danyo, and I've been just shown around this place, and I have got to say, I'll say it verbatim. It's the classiest hair restoration clinic I've ever been round.
Well, thank you.
It's like a spa. It's unbelievable. I mean, I don't know where to start. This place is fantastic. The town itself, the building that you're in, the entire premises is just
Have it the Southern hospitality.
yeah, it's just well, it's just so classy. But it's incredible to be here. I've flown in today as part of the hair loss lab to introduce and make more people aware of Dr. Danio. And we've been working together for nearly a couple of years now, but we've been in touch for several throughout the years, just constantly sharing information. We definitely are on the same page in terms of wanting to educate patients and provide patients information transparently. And it's an honor to be in your studio here at your clinic.
Well, thank
And
you.
so literally tell us a little bit, tell the audience listening a little bit about yourself, where you're located, and the incredible work that you do here.
Sure. Well, I originally am from Pennsylvania, came down to Atlanta, met my wife like the first week I was down here, and stayed here with my family. We're in Alpharetta, which is about 45 minutes north of the airport, so about 30 minutes north of Atlanta. And it's a beautiful area. And kind of my history of being a physician, I've been in medicine since 1990. That's when I started medical school.
Yeah.
And then did a year of surgery after that, and then physical medicine and rehab. I did a brain injury rehabilitation fellowship and then an interventional pain fellowship. So the interesting thing about this whole kind of brain injury and rehabilitation side of me is that I have seen the worst of the worst. Mm-hmm. I'm talking people that were in the hospital where you could hear the staff saying, we should just let them go. I mean, multi-trauma, severe brain injury patients. And then it was up to me to bring them onto the rehab unit, sometimes for 2 to 3 months, follow them out sometimes for years. And I saw potential in recovery that, very few doctors see. And I had a perspective of patience, following these people out and having just an attitude of gratitude and more of a, we're going to do the best we can and get you as close to 100%. Now, people think, oh, if I had a spinal cord injury or brain injury, just let me go. It's not true. People want to live. And suicide rates for people that have spinal cord injuries that can actually do it, it's equal to the general population. So people want to live. And so these recoveries that I saw and following these people out, and leading a team is so vital to what I do here in hair restoration, because we have a great team here. We are kind of dealing, obviously, with a different situation with hair restoration, but I think there's almost an equal devastation when there's hair loss.
Yeah. Well, that perspective you just talked about there and discussed is something just witnessing walking into your clinic here. It's like I've said, this is so calm. This is so elegant. This is so classy. This is like there's no anxiety. The anxiety shifts when you walk through, when you approach the building. Like even walking through the town, it's synergistic. So I have to say, I think your insight there into what real trauma is, what real kind of pain and real life issues have transcended from that based on your own personal experience of losing your hair into creating an incredible kind of facility here that eases that patient's kind of anxiety into, as we know, as hair loss sufferers, going into that leap of faith of hair restoration, hair transplant surgery, that you are holding their hand before they've even walked in the door, because it's just so calm. It's just smooth.
Wow.
And I think that's come from your life experience of what you've encountered and what you've witnessed.
Yes.
And I think that is represented in your clinic here uniquely.
Sure.
It really is.
You know, I'll give a quick patient that was really just a shining star for me. It was a younger patient, 15 years old, that got bitten by a mosquito at camp and had a severe encephalopathy. Was essentially in a vegetative state for over 12 months. And she was the only child. Her parents had heard about me, and they said, we'd like to bring her in, but the only way we can bring her is by an ambulance. And I said, well, let's do this. We stopped seeing patients at 12. Why don't you come in at 12? We'll have the ambulance come, and I will spend as much time as needed with you. And we spent about 2.5, 3 hours, and she was on so much medicine. I mean, it really sedated with anti-seizure medicines, anti-vomit, or vomit medications, sleep medications, all this stuff. Nobody ever gave her any rehabilitation for an entire year. This is now a 16-year-old girl with desperate parents. And her responses were so delayed, but she was there. And I called the insurance company. I said, listen, you need to give me 2 to 3 months of inpatient rehabilitation with this patient. I'm going to wean her off all the medications, and we're going to get her going, and we're going to have an impact. I can say this with, unbelievable humility. She is married.
Wow.
She graduated college as a summa cum laude, and she's a physical therapist. So,
wow.
But that was me as a physician taking on a different tact, not looking at the dogma of what medicine tells us to do.
Yeah.
Well,
helping her through a very, very difficult period.
So in hair restoration, there's so much dogma related to how doctors are trained and how they treat patients.
Yeah.
And a simple thing like, when can I wash my hair? I mean, I've heard as long as 10 days. And our thing is, you can even wash the night of the procedure. Why do you want all these scabs?
Variables.
And why wound healing? The evidence shows that you need to clean wounds. And now you have, if you do 2,000 grafts, you have 4,000 wounds on your head. Yeah. Clean the damn thing. So, but that dogma is scripted into how patients are treated. And it's wrong, because not washing for 10 days is gross. It's humiliating. It leads to isolation and despair. And we're getting back into working out. I want this experience to be great from the start. We do the podcast to educate people, get people knowing our clinic.
Yeah.
And when they come to Alpharetta, they're like, wow, this is a special place. They come to the office and meet the staff. We just compound, all those feelings, and then it touches off the recovery, which I want a blip on the radar screen. I don't want this to be a major life event. I want it to be something that's empathetic to your needs. I've been through it 3 times, had my head shaved 3 times. And for me, it isolated me. Yeah. We talked on camera. I felt depressed.
Yeah. Well, just on that point of just coming into your clinic today, it's like you walk in here and it's like a spa, but it's not you're not trying too hard. In the sense that you're at a spa, it is just calm. It is relaxing. It is just like what patients essentially need.
Yes.
And you've obviously hit the nail on the head in terms of providing them that really clean experience through. But Doc, obviously, what's really important? I mean, I'm so honored to be here in your podcast.
Likewise.
Presenting the Hair Loss Lab, my podcast.
Yes.
I brought in here today for
Nice.
you some merch. I've got the doc, his
Let's go for it.
own cap.
Yeah, we got it right there.
He's got all the merchandise. But we're
Got the
here
shirt.
today, more importantly, to you've got to show them the T-shirt,
Yeah,
doc.
right there.
Yeah. So,
got that.
but what's an honor is to be in this studio with Dr. Dan to discuss hair loss and hair restoration, because we can sit here and talk to you about how great the clinic is. And the reason that I've done that is to just give you a bit of an insight into the man that is performing surgery, who has had surgery, who knows what those patients are going through. I've had 13 hair transplants myself, so I know the process, but it's incredibly empowering for me and reassuring. When I work with surgeons, Dr. Dan is part of Specs Hair. He's a part of Ape to Gentleman's best hair transplant surgeons in the world, which is predominantly about education. It's not about a list to backslap, to inflate egos. It's about education. And what Doc is providing here is a seamless education process without people even realizing that they are learning. They're experiencing your experience of what is important to the patient.
Yes.
And that takes some doing, because I've been to countless hair transplant clinics. I'm on a bit of a tour at the moment, going around America, and I could probably go on record now and say, if any clinic, I feel bad calling it a clinic, but if any doctor's
Office.
practice
Yeah.
can carry a torch to this, I will be impressed, because I could actually give you the Spec Hair seal of approval. This place is a 10 out of 10. I think it's an 11 out of 10. But, and that's all credit to you. But more importantly, Doc, because we've got to get into the nuts and bolts, what people want to listen to is hair loss.
Yes.
And hair restoration. And I suppose my question to you, of being so experienced in this field, what is the most misunderstood component of getting a hair transplant procedure? And what I mean by that is, it's like everybody, just like now with social media, everybody's just kind of like, oh, right, I'm going to get this done. I'm going to go to Turkey. It'll be cheap. It'll be affordable. But what in your opinion, and we'll discuss this, are the real kind of misconceptions, are misinformed, and why do you feel that is?
Yeah, I think the biggest thing is that there is no person that is the same. And everyone's life experience is not the same. Everyone's psychological state is not the same. So if you kind of take a cookie cutter approach to hair transplant and say, all you're doing is moving a hair from here to here, that is the wrong concept. And what happens is you have these kind of budget places that charge extremely low costs, and really in the States, what they charge in other countries, I mean, the practice would be out of business, because you wouldn't be able to manage your overhead. But the thought is, this is super easy. There are no variables, and everything's going to work out great. The thing is, nobody is the same, and there are massive variables. Just look at me evaluating a patient as a doctor. I have to look at past medical history. Is there heart disease, diabetes? What medicines are you taking? What allergies? And that's the bottom, part of what we're doing. The next part, as far as hair goes, I mean, on the extraction side, there's so many different skin characteristics. For one, you can have very lax skin, very tense skin, very thick skin. It can majorly impact how easy those grafts come out, both on when you place the extractor into the skin and when you pull that. You could have tethered grafts. They could be splayed, curly grafts. Then you throw in ethnicity. I mean, one of the toughest ethnic classes that I treat is actually around India, Pakistan. That region, the hair follicles are tough to get out, and they have a different makeup.
Physiology,
Yes, different makeup compared to somebody from England or Nordic descent, or And so you have to take all of this into account as you're grafting. There are different density issues, the coarseness of hair. Tethering of grafts is huge because the deeper you go with the extractor, the more chance you have to, transect it.
Yeah.
But if you're not deep enough and you can't pull it out, it's like pulling dandelions out all day.
And on that point, all the different tools that are out there, but all the different people using those tools.
Yes.
So is it doctors performing the actual surgery?
Exactly.
Hey, which we know
Yes.
that it's kind of rare to have a surgeon
Yes.
in the room even performing the surgery, hey?
Yeah, and
Which people don't understand.
I know, and people are getting sedated with no medical provider there. In the state of Georgia, if the doctor performing the procedure is doing sedation, that's against the rules.
Wow.
You need to have, if you're getting sedated, you need to have another provider, whether a nurse anesthetist or a nurse practitioner, a physician's assistant. Somebody else needs to be administering sedation. But there are clinics all over the place that are sedating people, and there's no doctor involved, which is, it's illegal, but it's completely unethical and unsafe.
Well, that is one point,
Yes.
but also there's surgeons that aren't even in the facility.
Exactly.
And people are scoring the skin. People
Yes.
are performing surgery
Yes.
that should not be.
Yeah.
So there's so many different layers
Yeah.
to what is actually going on. So when people are venturing into hair restoration, what they don't realize is it's not a cookie cutter type of
No.
procedure. But one of the biggest conceptions that I think we need to kind of address is, we need to pull this back to basics for people that are coming into hair restoration that want to get a hair transplant, that think that it's an easy, quick, and potentially affordable fix. But what they don't really understand is that hair loss is progressive. And
It's a glacier that keeps moving.
100%.
Yeah.
And the secret to one of my successes, despite the fact that I've had 13 hair transplants, and my story is unique and it's been well publicized, but the secret to my success is not the hair transplants. It's the preventative treatment and measures I put in place and are religious about.
Yes.
And the point I'd like you to kind of mention or discuss rather is the importance of preventative treatment, because hair loss is progressive.
Yes.
So when people are venturing what they feel is into getting a hair transplant, that's going to solve all their problems. If they don't build a wall, or rather, they don't build a foundation to build the wall on, that wall's going to fall over in a matter of years,
Yes.
especially depending on how aggressive the hair loss is,
Yes.
especially with young guys.
Oh, yeah.
Young guys just think they can go and venture, get a hair transplant. Oh, I won't worry about it when I'm 30.
Oh,
Well,
yeah.
I'm 50.
Yeah.
You're a couple of years older than me,
Well,
although he doesn't look like
I'm
it.
almost
He does
59.
not look like it. I think he's the youngest looking 59-year-old I've ever seen.
Yeah.
But the point is, this is what the Hair Loss Lab and what Dr. Danyo is all about. It's about education, and it's about making people aware that you can go about getting a hair transplant. You can really potentially, if you catch this early enough, really restore resolve your hair loss issues, but you have to go about it the right way. And the right way isn't necessarily the way you want it, what you want to hear. And the Hair Loss Lab and me, Specs Hair, Dr. Dan are all about telling people what they need to hear. So tell us a little bit about your opinion, your experience of the patients that you meet that are, what? I have to take medication? I just thought I could get a hair transplant.
Yeah. Well, I mean, you can call it continental drift. You can call it, a glacier that keeps on moving. Hair loss is relentless, especially if people have a deep family history of hair loss.
100%, especially the younger they start as well.
Oh, yeah, exactly. So, I mean, my opinion on medications for a younger patient with a strong family history is less compared to somebody who's like 65, has some thinning, minimal family history, and you're doing the frontal hairline to touch it up. Totally different scenarios, but DHT is a killer for hair cells. Everyone knows what anabolic steroids do. They build muscle. DHT, which is also in the steroid family, is catabolic. It actually prevents certain pathways, especially something called the Wnt pathway, which is critical for highly metabolic cells to regenerate and produce hair. And it literally switches it off or dials it down. It creates inflammation, scarring. This is a relentless process that keeps going. So when I talk to patients about medications, there's always like, I don't want any chance for sexual dysfunction. Well, the sexual dysfunction, if managed properly, I mean, you can use low-dose finasteride, which works just as well as taking it every day, greatly reduces sexual dysfunction. I've been doing it that way since 2016.
Right.
I rarely, if ever, have people with sexual dysfunction. If I do get it, it's usually pretty rapid, and they're maybe genetically, it might not be the best fit. But I think if it caused liver failure, we'd all be on it. You know what I mean?
Yeah.
But there's something about sexual dysfunction that just hits guys, right in the sternum and says, and elsewhere. But where
they do happen. I mean,
Yes.
that's legitimate.
And it is very legitimate.
Yeah, definitely. But we're not saying that isn't. But it's about there is a way to try and navigate that
Yes.
if you're susceptible to those side
Sure.
effects. Because I never experienced any of the side effects.
Yes.
And there's loads of urban myths as well around medication.
Yes.
For instance, it decreases kind of fertility.
Yes.
Well, I was on finasteride for well over 10 years, and
Yes.
at first attempt, my wife and I conceived twins, boy and
Yes.
girl. I'm like, geez, this is a fertility drug. So we can counteract any argument there. But I say that respectfully to
Yes.
people that do have concerns around all the issues that arrive with finasteride. But nonetheless, I think it's important that the argument is balanced. Not argument, that the discussion is balanced.
Yes.
Because I'm not necessarily saying that finasteride is a fertility treatment, but that was my personal experience.
Yeah.
And it's important because, Doctor, you've witnessed so many countless patients that have had legitimate side effects.
Sure. And unfortunately, in my practice, it's about 50-50. I mean,
it really?
Yeah. And, there are plenty of clinics that say if you don't go on finasteride or dutasteride, I'm not going to do the surgery, which I think is wrong. I mean, this is a personal journey. I'm here to help.
It just needs navigating
Yes.
that process, that long-term plan needs to be altered.
Altered, yes. But the people that are on oral medications, finasteride or dutasteride, I like dutasteride better.
I'm on that now, actually.
Yeah,
Been for several years.
I think it's a lot better.
Yeah.
It hits both types of the enzyme that produce DHT and is, stronger with a longer half-life. I don't see as much sexual dysfunction on dutasteride.
Interesting.
Yeah. And I rarely see it with finasteride. So, again, if prescribed correctly, it can be managed. And then oral minoxidil, that combination is
that's
unbelievable.
a really positive kind of
Yes.
introduction. I think people have been experiencing really positive effects from
Oh, absolutely. And then, if you don't want to take pills, I mean, there are prescription topicals with less chance of systemic absorption.
Yes. But again, this is really important, you see, and people don't really, what we're trying to make people understand is everybody's so different, aren't they?
Yes.
And everybody responds so differently.
Yes.
So it's very difficult to give each individual patient the best possible plan of action for them because they kind of have to go through that process themselves to see what works
But it
best.
talks about everybody's different.
Indeed.
Everybody's, it's kind of like I'm listening to a book right now, great, called The Psychology of Money. And, there are people that have no education, didn't even finish high school, that died as multimillionaires. Because of their behavior, because of their psychology, of how their life experience, of how they deal with money. Then you have people that are Harvard trained and have all the finance degrees and all that stuff that end up broke. Yeah. You know what I mean? Or you think of all these athletes. You know what I mean?
Yeah.
So there's a huge psychology in money, but there's a massive psychology in hair loss. And the medications are one. The before issues, before getting a hair transplant, I feel people over-research. They rely too much on things like Reddit, people's comments that had like a negative issue. Maybe
you can have too much information, can't you? Yeah.
And people are bug-eyed when they come in. I generally tell people when they book with us, because I generally talk with them before, just turn everything off, please. We have plenty of information that we're going to give you that's specific to what your experience is going to be, pre-op, op, post-op, and it's just noise. And the people that listen to me, they come in, it's usually high fives and hugs. If people are over-researched, they are nervous. You can tell.
Hypervigilant.
Oh, yeah.
Yeah, yeah.
And then it takes hours until they finally say, my gosh, this is so much better than I ever thought.
It's interesting. Your background is pain.
Yes.
And I've, alongside my whole journey with hair loss, I've been unfortunately, not recently, but for years, in a severe amount of different pain elements. Like had a bad back, then that transcended into a bad like upper back, then my shoulder, and the whole kind of retrospectively, what I realized is there was definitely a physical issue that caused me to have the symptom. But what happened is I became like a pain procrastinator.
Yes.
And you could become hypervigilant and you become super aware. So if then like I would roll my ankle or I'd be like, oh no, I'm going to be in pain for so many weeks because the brain is such a powerful tool.
Absolutely.
And that is something I'm sure you've witnessed with a lot of people that have been in pain, but I found such a correlation between that and my hair loss journey, because once hair loss is on your radar, it is like you're super aware. So you're checking every mirror, every scenario, every photo. It is like a go-to, like a prerequisite. It's like subconscious. You're thinking about, and that just compounds the issue so much and keeps that I've discussed it on a recent podcast, the doom loop of that cycle.
Absolutely.
So in line with what you just said of like, there's too much information, put it down. Don't research it too much. Get the facts, get the basics, get the premise, and then trust in people like yourself to guide you accordingly, because we're our own worst enemy in so many scenarios. And hair loss, 100%.
Big time.
Because that negative thought, that loop, is only putting a stress on the nervous system, which is then putting you in that fight and flight, which is then just amplifying all your thought processes around hair loss.
Yes.
So isn't that fascinating? Because I found it with pain as well.
Sure. Well, you know, if you get the chance, I'm going to give a little plug on YouTube. Watch Eric Church's graduation speech at North Carolina. Right. And it is unbelievable. He's a country singer, very famous, but he takes life and puts it into the 6 strings of the guitar.
Right.
And the last one is the E string. It's the smallest string. It's the most easily bent. It's the one that is who you are, because it carries the melody, you know, of the guitar. But it carries the melody of your life. And he talks about that so many people wait an entire lifetime for an opportunity to have greatness that never presents itself. You have to go out and let that music ring through your own E string. And I think the same thing is with hair. You have to go into this very positive, right from the start. It can't be gloom and doom. It can't be, well, I saw this and I saw that, and there did that, you know. I get this all the time. And unfortunately, I think it's the younger generation that is just really involved in these chat rooms and this and that.
It's
and then
easy to be pulled down into a mindset of, and unfortunately, there is, when we were growing up, the amount of information that was available on different topics was nowhere near. Now there's countless information on every single thing. And everything kind of contradicts everything else. So it's like this younger generation that are coming up and being exposed to all this, bless them, they don't know which way is up. You know, and sometimes ignorance is bliss. You know.
Well, you know, the interesting thing is, in my pain management practice, I used to be located closer to Atlanta. So I had, you know, higher educated, more control-oriented patients that oftentimes came in with too much information, worried about getting a procedure done. Their outcomes didn't seem as good. And then I moved about 15 miles north and it was a completely different population. And I had better outcomes, better procedures for patients because their attitude was, "Doc, you know best, and I totally trust you."
Yeah.
And so it's just that psychology that's different, you know.
Yeah.
And we talked about the psychology of money. It's the same thing, hair loss, but psychology is key. So my general thing is you need to take the information from experts. I think it's very easy to.
There's so many of them out there now.
I know.
Doc. Hey,
I know, but
everyone's an expert.
yeah, but to go on you know, on Reddit or some of these platforms where you have a patient that had a bad experience but is a great writer and is a great communicator and is communicating stuff, and we call that in medicine an N of one, number of one. A study that has one patient in it is invalid.
Yeah.
It's just not valid, and you have to go into the same thinking that somebody's comments are not your life experience, and they're don't have the same variables.
Well, this was kind of why I wanted to create an environment and a platform to relay information to people based on experience. Now, I'm not saying I'm not the oracle.
No.
Okay, I don't know the answers to everything, neither do you. But what we do have and what we can relay to people is experience. And I think there's a great deal of kind of value when creating trust with people from experience that is authentic and legitimate. People take a huge value in that, and people can see straight through what is not legit and what is legit.
Sure. Well,
you know, so
I just dropped my water. I'm looking at your cup right here. I mean, this is incredible. I mean, you look at it, educate, empower, elevate. I mean, what can you say?
You do? I'm putting the onus onto you guys to do your own due diligence. I can point you in the right direction, but it's up to you, because then if you can, you've got to go through, sometimes you've got to go through this journey. If you ever read The Alchemist, great book. Okay. It's like he pretty much finishes where he started, but the journey has taught him so much. And that's what I'm about. And that's why I've created the Hair Loss Lab. And that's why I'm so proud to have you actually as my official first guest on the Hair Loss Lab.
Well, I appreciate
in
that.
your studio. Because I want patients to have the ability to see how legitimate this conversation is. This isn't manufactured. We're shooting from the hip. I've come in on the red eye. But there's nothing I don't enjoy more than talking with people, like-minded people, about educating.
I had to give you 2 Tylenol.
But that's what this is about. And that's why it's so easy to discuss it, and so easy that the conversation just flows, because we're talking about something that we love and we're passionate about. But the crux of it is trying to help and educate people in the right direction, because there's so much information out there. But Doc, what I do want to ask you is, you know, you've told us a lot about yourself and your journey and how you got here. Tell us about a case or a patient, and there must be many of them, but one that's really stood out that makes you smile and go, that's why I do what I do.
Yeah. Well, I can think of a 24-year-old patient that at age 22, so he is a senior in college, was having headaches, gets an MRI, and they found not a glioblastoma, but an oligodendroglioma, which is not quite as aggressive, and it can be treated successfully with surgery and with radiation. Unfortunately, he went through a big surgery with a big scar right here, and had radiation, which gave him radiation-induced alopecia. And so he came in with his mother, who was just so supportive, and his sister, who dearly loved him, and his father. And we said, I said, we can help you out. He had gone to multiple clinics before, and they said, oh, it's not going to work in the scar. The radiation-induced alopecia, it's not a good, type thing. And, have you considered Topic or a hairpiece? I mean, this at this point, a 24-year-old kid who did not graduate. He went through 2 years of treatment with this. So anyway, we ended up say no. We can do hair transplant. And we did actually a shaveless procedure. So we didn't shave his head. We kept everything long in the donor site, which honored him, empowered him. My thought was, you've already had a shaved head.
Yeah.
You know what I mean? I don't want to put you through
Yeah.
the agony of this, but we do this very frequently. So we did a shaveless procedure. And anyway, he was back at school. And then he came back at 5 months. And I saw him on the schedule, and I said, he seems to be back early. And I was thinking, oh my gosh, did
Yeah,
something
we've got a
go wrong?
problem.
So I walk into the room, and he has a baseball hat on, and he took it off. And I'm telling you, full coverage.
No
and his
way.
hair had grown that
After
much.
5 months.
After 5 months. It's like he never
Wow.
lost any of the hair within the
He must
follicles.
have been chuffed. Like,
Oh my gosh. And then
and his
I
family.
literally, I get emotional thinking about it. I said, I'll be right back. I burst into tears.
Oh, bless you, man. And I can see you emotional now.
Yeah.
That's amazing. How
Yeah.
beautiful.
Oh, yeah.
To change someone's life like
yeah.
that.
Yeah. And so I came back in, and it was, one big group hug, all the staff.
Wow.
And, yeah. And, he said,
Oh, well done, man.
oh, yeah. No, he said, you got my life back.
Oh,
Yeah.
Well done.
Oh, yeah.
That's amazing.
And I finally closed this chapter of this brain tumor and this scar, all the garbage, associated with that. And he's graduated. We've had follow-ups. He's so happy. I mean, he's just
Oh man,
moving on.
I genuinely didn't. That question, as you realize, was not premeditated.
No.
I didn't realize I was going to make you as
Yeah.
emotional as
I know.
that. But I think that goes to show how incredibly authentic this man is, and how much it means to him to change people's lives. And that's why I'm so proud to have you a part of what I do,
Yeah.
because I can assure you there's not many surgeons out there that have that true passion to be able to help change people's lives. So I'm I don't know, I'm speechless myself. And so thank you so much for sharing that with us.
Yeah. But my general thought is concealment is key for hair transplants, and we do no shave and even long hair procedures for concealment. Most of my patients are not just totally bald.
Yeah,
you know what I mean?
Yeah.
We do a lot of frontal hairline work, a lot of crown work, a lot of professionals. We're just, people that they do not want anyone to know. I've had people that aren't even telling their spouse.
Yeah. Oh, that's a common one.
Both ways.
That's hard work.
Like the wife not telling the husband.
Energy it takes for a husband to go through this process and not tell his wife.
Oh yeah.
Oh.
I tell her, I wish she was involved, but that's your decision. But
'cause it make it so much easier. And the irony is the wives would be like, oh, darling, oh, gosh, I didn't realize. Let me help you. And then the burden we carry as hair loss sufferers is insane.
Oh, yeah. But, people are still, they still don't believe that their donor site is going to look the same as when they walked in. Even when we do 2,000 grafts, their donor site looks the same. We use DHI. I've been doing that since 2013. It's very clean. We don't have a lot of tumescent fluid to lift the skin off the scalp when you do pre-slits. We have minimal swelling, minimal pain. I don't really sedate anybody. Everybody is fully awake. But with my pain management skills, I can really numb people up quickly, very easily. They're relaxed. Most people fall asleep. And I want, these clinics that just sedate people. I've had so many patients have hair transplants at other places. And I'm like, how many grafts did you have? And they're like, I don't remember a thing of the day.
That's frightening.
It's frightening.
Yeah.
And so what are they concealing, for one?
Yeah.
In a lot of these places that do this, the doctor's not involved and the patient doesn't know. I want people to be awake. They can hear us counting. They know exactly what they're paying for. And we're very, open with how we do it. They can visualize the graphs, and they remember a great day. But at the end of the day, with these shaveless cases, especially long hair cases, I mean, their spouse comes in and they come in kind of shy and with lots of trepidation. They're like, "Oh my gosh," no bandages, minimal bleeding. And that is, for me, just an absolute joy. Now, a lot of physicians' offices don't do shaveless. They don't do long hair.
Yeah.
And I always...
Because it's essentially a lot easier.
Oh, yeah. But, we work on efficiency. We work on team approach. I can do a shaveless procedure as fast as somebody can do a shaved.
Wow.
Yep.
Interesting.
Yeah.
So obviously, Doug, there's a really important factor which people, again, going into hair restoration, don't understand the importance of donor management and the fact that hair restoration is a hell of a journey. It is not something that you can just venture into and not be too concerned down the line, even if you're taking preventative treatments, even if you've got no genetic history of hair loss other than kind of minor hair loss. A very ethical surgeon such as Dr. Dan is the fact that they are always kind of like a snooker player, 3 shots ahead of playing the one that they're playing, and always thinking long-term, preserving that donor supply so that there's always kind of bricks in the bank to build the house.
Yep.
Yeah. So tell me about your philosophy about donor management and how you, whenever you treat a patient, of how that is at the forefront of your mind.
Sure. So, everyone's heard of the Norwood scale and all that stuff, but
explain that briefly, just the Norwood scale of how, briefly in terms of 1 to 7 and how that works.
Yeah, I mean, you've got 1 to 7, 1 being just, mild recession. Generally, that's more natural recession.
People can deal with that, or, it's generally, once it starts creeping past that, then that's when the hair loss demons start to creep in.
Exactly. And then, obviously it progresses where it goes into, further back and then into the crown and then the middle scalp. So,
and it's a generalization, the Norwood scale.
Exactly.
It doesn't follow it verbatim. It is just to give an overall perspective on the different scales of hair loss.
Sure. Yeah. And then you also have to take in how big is the head and how much hair loss is there on the side and how much miniaturization is present. You have to really evaluate the scalp. But, the head size is a huge issue because if you have a really wide head, in some it's even long. Yeah. I mean, you could potentially double how many grafts are going to be there. So when you look at a donor site, you have to think of it like a bank account. And I'm your financial guy managing your account. Yeah. And if I wasn't, if I took $10 from your account and you were like, you just took $10 away? Yeah. And I didn't manage it, you would probably let me go. So in my mind,
especially if you need that $10.
Yes.
Oh,
absolutely.
If you've got millions in the bank account, you take $10. It's not really going to be that relevant.
But principally, they would say, you're out of here.
Yeah.
You know what I mean?
Exactly.
So this is gold to you. And so I'm managing this pot of gold. And so as I'm harvesting, I have to manage it in the way that I'm going to get optimal wound contracture. It's not talked about enough on the web, but anytime you take an FUE graft, there is a circle. That circle will contract. And if you, let's say, do 2,000, that's a pretty good harvest there.
Big impact on the scalp.
That's 2,000 wounds that have to contract. Now, if you add another 500, then you've got 500, and they can start to kind of compete against each other, and you don't get the wound contraction.
Of scarring there.
Yes.
Yeah.
So if somebody needs even more than 3,000 grafts, especially for 5, 6, I've had somebody I've done 12,000 grafts on.
What would you say the average, in your experience, because it all varies from patient to patient, but on average, what do you think the average person, Joe Bloggs off the street, has got as a donor supply to work with?
I would say it's between 4 and maximal 6,000.
Wow.
Yep.
Okay.
Yep. That I think safely. In the way I do it, there are people that say, "Oh, we can get 10,000."
Because there's surgeons out there that are claiming to perform 10 to 12,000 in a session.
I know.
What's your thoughts on that?
I don't agree with it.
Yeah, right.
Yeah, I
But
think
you don't agree with it, but are you saying that they're not extracting those numbers of grafts, or they are extracting those number of grafts, but the repercussions of that down the line are yet to be seen, or
well,
they
well, I mean,
or
you're
ethically not put the patient in the best situation moving forward?
well, the marketing is such that, oh, we can do 10,000 grafts and you're going to look like this. Well, what are the variables of the patient? You know, how long did the patient case take? Any complications? Do you have pictures of patients that went wrong that
But
had?
it's not saying that there aren't patients out there with that amount of donor supply
Yes.
available to them.
Exactly, but I'm saying on average.
Yeah.
You know what I mean?
I agree.
I've done 9,000 from some of these
I
donor
moved the
sites.
parameters of that question
Yes.
there, but thanks for bringing it back.
Yes, yeah, but I've done even 9,000, but I did multiple cases and I managed it. You know what I mean?
And the impact and the trauma on the scalp to do
Yes.
that amount of grafts in one go alone, even if you've got the donor
Absolutely.
supply, is quite an impact on the scalp.
Yes, and people heal differently. Some people have great wound contraction. You go in the second time, you can barely see any evidence that you were there. And then you have other people that have big white dots.
Yeah.
You know?
Yeah.
And there's
Oh,
been,
I've got them. Yeah.
Okay, and there's been minimal, wound contraction, and that all relates to laxity and tenseness in the scalp. But my philosophy, if you were coming to me and you needed 4,000 or 5,000 grafts, I'm already planning even the first procedure, looking at other donor sites. I do a lot of beard extraction under the jawline. I do a lot of chest, abdominal hair. I like the beard hair just because it has a very similar growth cycle as the head hair.
But it has a completely different characteristic.
Not necessarily.
Oh, right.
Yeah,
Okay.
I mean, you have to look at the beard. I would say there are lesser people that have that really coarse, burly hair. Like, you don't have super coarse beard hair. Yeah, I don't. You know what I mean? It's coarser. But when you're discussing things, if I do 500 beard hair versus 500 head hair, this will look like 750. At least minimal because of the volume, and you just have.
But you'd put that. Sorry to interject. You'd more than often utilize that type of hair in areas such as scarring, crown,
middle scalp.
You wouldn't put that on the hairline.
I've done it on the hairline.
Oh, have you?
Yeah.
Depending on the hair that you've extracted and its characteristic.
Yeah, we do a lot of major repair work, especially for people that have. Been through the ringer, like starting in the 80s with the plugs, and then they had multiple strips, and their donor site is shot. And a lot of times they get these big alleyways of kind of really severe density loss or even skin transformation because all the transition zones between the side and the top have just kind of sagged down. So a lot of times we're pulling plugs out, moving them around, and then we have no donor site from the head. And so we have to do hairlines, side temporal work with beard.
Yeah.
And I've been pleasantly surprised. I think it is way overstated that beard hair, because of its coarseness, is going to look funny, feel funny. It can be that way if there's a colorization. Some people have really red beard hair and brown hair. It might not be a great match, although we can pick out the brown hairs.
Black hair, ginger beard. It's never a good combo.
Exactly. But I rarely have people talk about the coarseness. If anything, if I have to do more, a lot of times we start in the front. If I do 2,500 grafts, I love doing 2,000 from the head, 500 from the beard, sometimes 1,750 from the head or 750 from the beard. We're doing hairline and head, mixing all the beard hair behind it. And a lot of times they come back for a second procedure and they say, I want more beard hair.
Yeah. Oh, interesting. You like to just kind of distribute that donor supply from just spreading out the love.
But it gives people options, because if somebody needs 5,000 grafts and they're, let's say they're 30 years old and I blow out their donor supply.
Yeah.
What if they need more?
Yeah.
You know what I mean?
Oh, yeah. Well, that's what it was down. It's about supply meeting the demand.
Yes.
Short, mid, and long term.
Yes.
And sadly, the majority of the emails or contacts or DMs on Instagram that I receive tend to be more people like, I fucked up here. I realize I went to Turkey. I went, and there's some great clinics in Turkey. I work with a number of fantastic surgeons in Turkey. But the common story I hear is, I realize I've messed up. I didn't do my due diligence. I went to Turkey, and sadly, I don't even know how many grafts I had. I think I've had 5,000 grafts, and now that patient is in a much worse situation than he was originally, because one, he's got to deal with the repercussions of the surgery on his physiology, repairing potentially unnatural work in inappropriate areas, low hairline, but more importantly, because that can, for the most part, be resolved, but the most important component is we need the bricks to build the house. So if that donor supply has been exhausted, or essentially the limitations that can be presented on patients who've had inappropriate surgery, is the biggest issue that we are dealing with today in this industry from a longer term perspective of helping patients. Because if we've not got that donor supply to work with, we can't help them repair their situations. So this is why education is key, and understanding that when venturing into a hair transplant, choosing the right surgeons who's going to manage that donor supply short, mid, and long term is way more important than where you're going to position that hairline, or the different kind of what they feel are their priorities initially.
I think one of the toughest things for me to hear from prospective patients is, I want one procedure, I want it one and done, I don't want to have to come back. And it puts me in a difficult situation. And I've had plenty of patients, I said, I'm not your guy.
No. And how many clinics? Sorry to interject. This is the problem. How many can say, we can do that. We can sort you. We can do this all in one go. No problem. Oh, and actually, we can get you in next week because we've had a cancellation. And it's like the patient, the client is sold because they're getting told what they want to hear and not what they need to hear. And the fact, Doc, that you just said, I'm not your guy because I can't tell you what I can't do. And so many clinics out there will tell the patients exactly what they want to hear. And sadly, how many patients are you repairing as a result of that?
Oh, yeah. Well, an interesting thing, the International Society of Hair Restoration Surgeons does a survey, like every year, maybe every other year. And one of the questions on there, which I found is fascinating, is the question was, when you do a large frontal hairline case, how often do you have to come back a second time to kind of put the cherry on top and get it all built up? Do you know what that number was? This is internationally.
How many?
50%.
No way.
50%. Now, that's not necessarily my number, but it's not uncommon that people are super happy, but they're like, there's a little spot here and right here, and if you could add a little bit right here, then I'm perfect. And there is a subset, and I'm going to go back to more younger patients that are just really antsy to get this thing done, that when I have this talk with them, it's unacceptable. And again, I'm in a position now that I can choose my patients. You know what I mean? And I think that's a healthy thing, because you're choosing me. It is a healthy thing,
but it's a shame you can't help more. And
I can usually, talk people into a reality.
Well, there's talking people into it, or explaining the process more, which then enables people to get educated, go away, do their due diligence, and then realize, geez, this guy wasn't trying to sell me a procedure, he's trying to help me out. And that authenticity and that trust that is built is then, that's why you're so popular, and people are like, you've got a several week, month waiting list of patients that want to come to you, because not necessarily to like have the procedure done in the sense that, oh, this guy, but because they're going to be guided correct. They feel confident that this guy is going to guide me and give me the best possible outcome I can achieve, because I realize he gets it. He's not trying to sell me anything. And that, ironically, is more appealing to patients than being told what they want to hear.
Yeah, I tell patients that you have your own story, your own life. I am your guide. I'm not the hero of the story. The hero is you.
Yeah, yeah.
You know what I mean? And if I have that attitude, I think in marketing, so many times the clinic or the doctor is the hero. You know what I mean? They've got
Oh, yeah. There's some egos,
they're
buddy.
showing their device and
Oh.
this and that. But my tact is a little bit different in that I'm really your guide. You know what I mean? And I want to make you the hero of the story at the end.
Yeah.
You know, that's like how
Yeah.
the best movies play out.
Yeah, use me or don't use me.
Yeah.
That's your decision.
Yes.
Not like you've got to use me because I'm the best.
Yes.
That common sense just straight away puts that barrier up.
Sure.
Or if it doesn't, if people don't see through that, if anybody tells you you've got to come to me because I'm the best, I would run.
Yeah.
But Doc, what would you advise anybody that's out there that's now kind of researching hair transplants, researching hair restoration? There's so much information available to us now via all our devices. You know, before you know it, you're doom scrolling and you've seen a clinic. What advice would you give? Because there's so many different resources. There's so many fantastic resources. And this is why I've tried to really have a voice. I've been very fortunate to have a voice in the mainstream media, like coming on your podcast previously. I work with different publications and blogs. And what I try to do is give people options and resources. I'm a big component of telling people about the IAHRS, about different platforms, about other patient advocates, because I'm not here to sing my own trumpet. I'm here to give people information to go out there and do their due diligence so I can then sleep well at night and go, well, I've provided them as much information as I can. Try to inform them that this is the way to go about it based on my experience again.
Yep.
I'm not telling you where to go.
Yep.
I'm not telling you that all the surgeons that I kind of represent and work with and so are all the best of the best. That is for you to decide.
Yes.
What I'm trying to do is give patients a fighting chance
Yep.
of streamlining the information, at least into a succinct way
Yep.
that they can go about this as safely as possible.
Yeah.
What would your advice be? Because you come at it from a different perspective. I'm coming at it from a patient advocacy perspective. You're coming at it from a doctor perspective.
Yeah.
But this is where I feel strongly we align, because you really truly respect and get what I do, and I truly respect and get what you do, and that's why we've been an association.
Yeah. Well, I think, first of all, it starts with you. It's often easy, you're looking at yourself in the mirror and just beating yourself up. You have to be nice to yourself. It's a fundamental secret.
Help yourself.
That successful people have. I mean, they have a psychology that they've adapted where they're good to themselves. They don't beat themselves up. So that's number one. Number two, I think you need to go into this and prioritize what your needs are. Is it to get it one and done and just, knock it out?
Get past this as quick as possible.
Is it a financial situation where you may have to, look at kind of lower level clinics just to get it done, but do that with a lot of trepidation, because I'll tell you, it costs a lot of money to get it fixed.
Yeah, you pay for what you get.
Yes, exactly.
In hair restoration,
and
you do.
It can be done in a very unsafe and puts you at jeopardy. So the next thing is going to be the psychology of concealment. And again, that's what I have been doing since 2013, what the practice has been doing. If you want to be concealed, you look for physicians that do shaveless procedures or long hair procedures. They're not a lot of them. You need to find offices that have doctors that are actually doing the case, that are associated with the ISHRS, which is the International Society of Hair Restoration Surgeons, that have board certification through the American Board of the International Board of Hair Restoration Surgeons. These types of associations, and especially kind of certification through the board, make things more bona fide. Now, I have to get recertified for the board this year. It's been 10 years. So I'm actually studying right now. learning,
And that's
you
for
know,
the
what's
ISHRS.
that's for the ABHRS.
Beg your pardon.
Yes.
Right.
Yeah, the ISHRS is more the research, you know, kind of community arm.
Because I think it's important we discuss these
Yes.
different associations or organizations rather, because anybody can apply to the ISHRS
Yes.
and become a member,
Yes.
can't they?
Yes.
But tell us a little bit more about the governing bodies that you're associated with
Sure.
and why.
So the American Board of Hair Restoration Surgery is, and it's also international. The whole body is less than 500 physicians in the entire world, and it is not easy to get. You need to do a minimum of, I think, 300 or 400 cases. You have to have everything documented. You have to be able to supply all these cases for review. You have to do oral and written boards, have proper training. So there are a certain number of continuing medical education hours that you have to do. And it was a long course. I mean, it took years for me to be able to actually sit for the tests. The tests were not easy. I studied actually for 6 months, before, and both the oral, the written, and then an oral test in front of some of the top guys.
Interesting.
Yeah, in the in the hair restoration world. I'm part of the IAHRS, the International Alliance of Hair Restoration Surgeons. And I would say that group of physicians, if you look at the list, these are the real leaders. They're the ones that are presenting at conferences, doing research. Doing.
I've been a big component of getting that organization out there for people to be made aware of. It's one I believe in. I believe in Spencer Coburn's message.
Yes. Yep.
Surgery as a last resort.
Sure.
And the IAHRS and the American Hair Loss Association are big components of what I've always promoted.
Yes.
Because I think it's really important that people understand the difference between what all these different organizations are about. And there's certainly two that I've been strongly promoting in the mainstream media for a number of years.
I mean, you could take any scenario in medicine. Let's say you were getting your ACL repaired. Would you want a board-certified orthopedist doing your procedure?
Yeah.
Absolutely. If you were getting heart surgery, absolutely you'd want somebody who had all the accreditation. You would want the best. And in hair restoration, we are permanently changing your appearance for good or for worse. And you can't go into this, willy-nilly without, picking people that are bona fide, people that are part of the ABHRS.
That are stress tested.
Yes.
Yeah.
And you can go to abhrs.org. You can go to iahrs.org. I mean, those lists right there are bona fide physicians. They've been through.
That's a great starting point.
Absolutely.
For anyone looking at hair restoration to do the heavy lifting in terms of streamlining and expediting that initial research process. But just on that point, Doc, it's always an analogy I use, and I have done before on live radio to try and help the listeners understand. When people are researching hair transplants, we've heard the stories. I found a clinic on Instagram because it had 1 million followers and it had so many likes. Yeah. And my retort to that was, well, if you're going for a heart transplant, would you go to a clinic that's just got 1 million followers on Instagram?
Yeah.
Because the comparison is very much like that. You would not choose a heart transplant surgeon based on their Instagram profile.
Yeah.
You would want to scratch the surface and understand something as important. And hair restoration is it's an organ. Yeah. You're moving it, much like a heart.
Yeah.
So you'd want to make sure that the person that's doing that surgery was legitimate, stress tested, had all the accreditation, was affiliated with all the relevant organizations,
had good
and not just had a really good, attractive Instagram page.
Had good reviews.
Yeah.
It's funny. I had a patient that I did a consult last week, and we've got, I think 300 5-star reviews plus. We have very few low reviews.
And no doctor bats 1,000.
No.
You know what I mean? I think
Yeah,
it's important
and
everybody knows.
We can't jive with everybody.
No,
you know what I mean?
you can't. And remember, one thing I've witnessed, and I've been in the trenches for 20 years. I've been in the forums. That's where I earned my stripes.
Yeah.
You know, that's why Specs,
Yeah.
the pseudonym Specs was formed because I didn't want anybody to know I had a hair transplant. So that's what I set up.
Your username.
But the point is, it's like there are so many doctors out there that claim, you know, they're the best and you know, their success rates. But no doctor can bat 1,000,
No.
as you say in the States.
Yeah.
And what I mean by that is, but also let's put that in context, because those patients that possibly do go online and aren't satisfied and aren't happy and drag doctors' names through the mud, good names, good doctors' names, what they tend to leave out conveniently is the fact that they've had several procedures. They're a repair patient. They had limited donor supply.
Yes.
They've been effed up before elsewhere.
Yeah.
But who's going to be thrown under the bus?
I know.
The last surgeon that performed the surgery.
Exactly.
And I think it's important that people know that take everything with a pinch of salt when you're researching and you see bad reviews about surgeons, because if they are a part of Specs Hair, the IAHRS, the American Hair Loss Association, organizations you've just discussed there, the chances are that they are good, ethical, honorable, honest surgeons that only want to do right by the patient.
Yeah. Funny thing about this story with the patient I was talking to, he said, my wife has one problem with you. She went through all the reviews.
His wife had the problem.
Yeah. You have too many good reviews. There aren't enough bad reviews. It goes from 5 and then the couple 1-star,
She
they weren't even
high maintenance.
but it you know, it was funny because he's like, are these reviews real? And I'm like, absolutely real. But
you can't do right for doing wrong, doc.
Yeah, but I think you need to look at reviews
with the jaundiced eye.
Yes, with the jaundiced eye, but there needs to be a pattern. Definitely. And there needs to be a story that's told by these patients of an empathetic, and as you have here, educating, elevating, you know, doctor
and empowering,
with a great culture in their office.
And that comes from experience.
Yes.
Legitimizing that experience. Yes. It's not cultivated in the sense that manufactured. Yeah. And this is something that I find a lot of people now are manufacturing authenticity, which is a worry.
Yeah.
Like, rather than it being it's been earned, it's legitimate. People now are actually manufacturing what is perceived to be authority.
Yeah.
And that's a worry. Yeah. Now, that's in every business.
Oh, yeah.
That's in every industry.
Yeah.
But in hair restoration, it's a worry.
It is. Yeah. I mean, the good thing is I'm not physically capable of treating every hair restoration patient, nor would I ever want to. But the way I approach things is, again, that foundation that I have from rehab, the foundation. My father, I spent a lot of time with him. He was the best.
What's his background?
Orthopedic surgery.
Oh, was he an orthopedic?
Yeah.
Beg your pardon, right?
Yeah, and he was literally the best.
It's in your DNA.
Yeah, he was the best physician that I ever worked with. Unfortunately, he passed away a few years ago, but he gave so much wisdom, and the way he treated his staff, they all came up to me and said, for your dad, I would do absolutely anything for, but the other physicians, no.
Right.
And so, but the way he treated patients, the way he treated his staff, the way he came as, you know, in orthopedics, you have fractures and things are devastating. Everything was positive. You know what I mean? And he always talked about there is a mindset when you walk into that room. And he also loved humor. And I asked him, why do you tell so many jokes or you know, make people laugh so much? He said, I don't do it, you know, to actually make people laugh. But the world is a tough place, and we all need to cool it. You know what I mean? We all need to settle down. So
we can approach this one of two ways: positively or negatively.
Exactly.
Sounds like Patch Adams.
Yeah.
Remember that movie?
Yes.
Yeah. Well, that's based on you know, that surgeon's bedside manner and the way that he approached that in terms of the psychology of medicine.
Yeah.
is a powerful tool.
Yes.
And that's a really good point
Yeah.
that, you can either go about this kind of very matter-of-factly,
Yeah.
or you can really embrace that patient. And one thing I know is a fact of you being that patient, being a hair loss, patient and a hair transplant patient yourself, you have an empathy towards everybody that walks through that door, much like I do, because I know what they're going through.
Yeah.
And that's where that legitimacy comes through. That's where that experience comes through.
Absolutely.
That can't be replicated.
Yeah. Well, think of the gift that I have for spending, all day with the patient, frequently for large cases.
You
Now,
get to know them.
most doctors come in with an iPad. They're typing as they poke at you. Does it hurt right there? My father was, you come into the room, you shake hands, and you instantly start examining people. Patients want to be touched, and you can talk and examine and distract and do things if there's a shoulder and you're touching somebody. Most doctors are even scared. They literally poke with their finger. It hurts right there. Okay, we'll get you set up for surgery. It's a terrible way to approach people. But for me, I learned so much from my patients. I've had so many great conversations with folks that have either great ideas, or a lot of the patients, you're waiting for things to percolate, and I've been surprised so many times, just at how dynamic people are. And for me, it's just such an honor to be part of having an impact throughout the day, non-sedated, having a great experience, and, doing a follow-up and just going through the journey.
And remember what's important as well as a hair loss sufferer and a hair transplant patient, it's you're seeing these people that are coming through your door at their lowest.
Yes.
They're coming to you at their lowest, whether that's and it's all relative to that individual, whether it's, some people are like in a really bad way.
Oh, yeah.
I mean, I've dealt with people that are on kind of like even wanted to end their life as a
yeah.
result of it, because it's consumed them.
Yes.
They've become too obsessed by it.
Yes.
It's become too much for them to bear. And I know for a fact, I can only imagine how many of patients of those patients that you've seen. So that's why this experience and this bedside manner and this identifying that without identifying it. You can see, you can read the room.
Yeah.
And your ability, and this is a real skill that very few surgeons in hair restoration possess, is this humility to be able to connect with patients. And the patients that I've spoken with that have been to you, and they've said, if I've heard it once, I've heard it 100 times. It's like, I was just at ease as soon as I went there, because he was just he understood exactly where I was coming from. And that is a really powerful tool in your toolbox as a hair restoration surgeon.
Yeah. I think it's just kind of a foundation.
Yeah.
And, I think my mentality, is not pervasive, unfortunately. There are different personalities. I've always had kind of a low-key personality, but I'm not a pushover. And I know exactly what needs to be done. I'm meticulous with a high level of OCD. And when I tell people that, you know what I mean, and kind of put it all together, I think that's why we have great outcomes. We've got great patients. I've got really good reviews. And I have a staff that has been with me, and we at times battle it out with really tough cases, but they're always motivated. They always come back the next day with a smile. They each give me a hug every morning, and I give them a hug every time I leave, because they love working here. And, it's just, I don't know. I think there are a lot of cultures in offices that can be toxic, what I mean? And in 26 years of practice,
I've heard all the stories from various different clinics.
You can have one individual that is,
it can rot the barrel.
Yes, exactly.
Yeah. One bad apple can rot the barrel.
Yeah. So luckily, I've being 26 years of practice, I've gained wisdom as far as what I want, and I'm not scared to say this is not a fit.
Yeah.
And I wish you the best.
Well,
you know what I mean? But the team that I have
pass.
now is just amazing.
Yeah.
Well,
it's interesting you mentioned that. And I mean this respectfully. You can't not have OCD, considering the insane attention to detail that this facility has. I said, I think I need to put on the back of the T-shirt that I've given you, Dark Horse, because you are incredibly humble. But just witnessing this with my own eyes, it's like, but you don't shout about it.
Yeah.
And people need to see this. And I'm looking forward to doing a bit of a video walkthrough with you to make people actually aware of this gem of a facility.
Well,
I mean that legitimately.
Yeah.
You genuinely witnessed my, how I expressed myself when I walked in here. I just couldn't, my eyes didn't blink. I was like, holy shit, this is insane. Like, I think a lot of clinics could take a lot
all
of
the
leaps.
gold. No kidding.
Yeah. Oh, well, listen, Doc, it's been an absolute pleasure.
Likewise.
I mean, thank you so much for having me here in your podcast to help me present my podcast to the world. Yeah. And I can assure you, I look forward to doing this again.
Yes.
My family and I flew in to Atlanta yesterday.
Yes.
I'm off to Arkansas because my daughter's going to look around a university, which is the main purpose of this visit for me. And I thought I can't not on this mission in here, flying into Atlanta, not come and see the great Danyo. So, thank you so much. Thank you for being so hospitable. And I just want to go on record how we were messaging before to try and schedule this meeting. Yeah. And the doc was like, well, what time are you landing? Let me come and pick you up. I was like, Doc, it's fine. I can get a cab. But that, again, is a reflection on you to want to kind of help me out. And I really, really respect that. And I want to say thank you very much for having me and looking after me so well.
Yeah. Well, I appreciate you coming, really.
Oh, awesome.
It's a total honor. So what do you think of the studio here?
I think it's just incredible. I mean, this studio has, without a doubt, inspired me. Kind of the whole objective of the Hair Loss Lab is to provide a platform for people to gain information. That's all it is. It's just another arm, another way to relay information. And looking around here, which I can't wait to take some footage of, if you'll allow me.
That's fine.
And I think I'm going to have to come to you for some advice on, because I have the means to be able to set something like this up. But what I want to do with the Hair Loss Lab is not necessarily do the traditional podcast sit down, which is fantastic. Yes. I want to relay information to people, tell stories to people, give people a variety of ways of getting educated. Yes. Now, whether I'm fortunate to be able to travel around, I think what you're going to do here, and what we are going to do, is make a lot of people aware of how people get information and relay information. I think you're going to set the bar here. I think you're going to set the precedent. I think a lot of clinics are going to start performing podcasts because it's well within people's means, but people have to have the desire to help people to the time and energy, which meanwhile, I don't know how you find the time to do everything that you do. I take my hat off to you. Before we even started the show, you were showing me a repertoire of your music that you've not only made, produced, sung on, and you're the only person playing the guitar in it. It's unbelievable. I think I'm going to buy your album. Hopefully you can give me your album. Yeah. But I think the point here is this studio has inspired me on my mission to pay it forward even more. And again, that attention to detail that you have gone to from the moment you open the front door to every single component.
Well,
I'm going to go to the loo and it'll probably wash my own backside for me.
We're working on it. Yeah.